So what causes a hiatus hernia?
So hiatus hernia is actually the opening that from in the diaphragm. So the chest cavity is separated from the abdominal cavity by a big muscle called the diaphragm. So in the diaphragm, there's an opening where the gullet or the esophagus goes through and joins the stomach. So this opening usually forms a tight loop around the esophagus that prevents food that goes down from the esophagus into the stomach, coming up back into the esophagus. In other words, it acts as a one-way valve. So there's a one-way valve between the esophagus and the stomach to prevent food from coming up even after you've eaten. So this prevents symptoms like heartburn, which is pain in the center of the chest and acid taste in the mouth, even things like excessive burping. Okay, so how is this? What happens during reflux is when the one-way valve is a bit loose or not functioning very well. What happens is the food and acid from the stomach refluxes back up into the esophagus and causes these symptoms that I've mentioned before. Okay. The usual treatment is, of course, diet and lifestyle change. It's eating small amounts, eating less acidic food, and eating early before you go to bed prevents acid from coming back up into the esophagus. If all these measures fail, then the next step would be medication. There are medication that reduces the amount of acid that can reflux back up, and there are medication that can prevent acid from physically coming up by pushing acid and the stomach contents downwards. However, if all these fails, which is very, very rare, the last resort would be surgery. And the last resort of surgery includes a keyhole method of tightening up the defect between your chest wall and the stomach. And of course, wrapping the stomach around the lower part of the esophagus. Technically, this is called a hiatus hernia repair and a fundoplication. So these two procedures come hand in hand in preventing further acid reflux. This entire spectrum of acid reflux is also known as GERD or gastroesophageal reflux disease, GERD.
Good.
Okay, so that's the first one.